Welcome to the Industrial Athletic Trainers Society VNS On Demand. We are excited to share with you value-added continue education programs. Stick around at the end, or check the video description for more details on how members can claim their CU credits.
Need to experience when they're employed and working in the industrial sports medicine, and are those different than what they learned in their education? I think you guys kind of know the answer to that from all of the emojis we saw earlier. And then question number 3 was really, what skills do graduates who are working in industrial sports medicine believe are needed to prepare them for working in this emerging setting? Right? So if you look back to your educational program, what skills do you feel like you could have learned there that would really help you become a better IAT? So that's kind of what we are going to focus on today. And really, like I said before, there is very limited research on this topic, and I feel like that's why this research is so significant. We really want to allow for a better understanding of the experiences that IATs have, and we want to meet those needs for this ever-changing profession. This study also can give current education programs, whether that be a master's program or a doctorate level program, the information they need on really what they can add to their curriculum to better prepare students for a career in athletic training on the industrial sports medicine side of things, while also showing students that really this is a very rewarding career that they can go into directly out of graduation. So as I talked about earlier, this is a phenomenological qualitative study. I did one-on-one interviews with each participant. I'll go through that a little bit more over Zoom. But to be able to actually be included in this study, you had to be a current board certified athletic trainer practicing in the United States. We wanted people who graduated from 2015 to the present, because obviously those education and curriculum is changing. So nothing against people who graduated before that. I am one of those, right? But to have just like that extra, let's see what they're teaching now, you had to, have graduated since 2015. You must have been working in industrial athletic training currently and for at least 6 months to be eligible for the study. And there really couldn't be any ties to the researcher, since I do work in industrial athletic training and I do support a team of providers. It, obviously couldn't be anybody who reported directly to me to kind of keep that bias out of things. So while I was preparing this research, there was a lot of background to it. The first step is always, collecting your data. But before you can do that, you want to make sure we're, crossing those T's and dotting those I's, and getting approval from your, local IRB. After I was approved for that, I started the recruitment process. So that really was love. You got to love technology these days. So it really was over email, social media, which included, closed societies like IATS, other organizations affiliated with industrial athletic training, and then through some employers of current industrial athletic trainers. So that recruitment email went out. It included an informed consent, so people knew what they would be consenting to be doing for this research. And then if they were interested in it, they filled out a quick demographic survey to give me just a little bit of preliminary information so I can see, what participants were interested, and schedule interviews based off of if they were really eligible with that inclusion criteria. Those virtual interviews took place over Zoom, probably lasted around 40 minutes with each participant of the study. And then after that, it was audio recorded and transcribed. So then that transcription actually went back to each participant. They were able to review the whole transcript of their interview. They could edit and, add anything if they felt like, what they said may have differed from what they meant to say. This process is called member checking, right? So we want to give them an opportunity to do that, just to let you know all of the transcriptions that were checked by the participants. No one really made any changes to their transcriptions whatsoever. And then through that, I used a program called Deduce, which is a web-based application that helps organize and analyze research using codes to generate themes. So I was able to upload this transcripts into the participants' interviews and identify really patterns and recurring relationships between different codes. And then during this process, I was able to take those coded data and look at the frequencies. And this kind of led to saturation. So once you reach saturation, that means pretty much everybody who's involved in the study is kind of saying the same thing. So you know that that really is where your data needs to stop, because you've reached that saturation. But I manually kind of grouped all of the related codes into themes and used a software code tree to do that. So this helped me really interpret the underlying patterns related with all of the participants' answers and create themes to interpret the results of the study, which we're going to get to. So give you a little bit of background on the participants who did lend me their knowledge of, their perceptions of their careers, which I loved. Approximately about 200 and over 250 recruitment emails were sent out. Overall, 17 people were eligible for the study. I actually interviewed more than 10 people, but after, really diving down through those, only 10 of those interviews were really eligible. So those were the 10 people used for this study. Qualitative studies are much smaller than quantitative, which I'm sure you guys know. So it was a small sample. Because people had to have graduated from 2015 and on, they only could really have been an athletic trainer for, less than 9 years. So the ages of the people who participated, 7 people were between the ages of 30 and 39, and then 3 were between the ages of 20 and 29. 3 had bachelor's degrees in athletic training, 6 had masters, and then there was 1 participant with a doctor of athletic training degree. The overall average years of experience as an AT is 7, and the overall average years of experience as an industrial athletic trainer was close to 3. So all of the participants in the study worked in warehouses, manufacturing, utility, transit, or distribution. So a good mix there. All right, so we're going to start looking at the results here. So I talked about those themes that kind of were created based off of what our participants were saying. So the first theme in the results really state that the skills that they learned in their education programs, yeah, they did carry those into ISM work, right? They did. Some of those skills were really important for them, and they were able to translate those to industrial sports medicine. Secondly, that there is a major benefit to prioritizing communication of ISM services and how to apply that to the workplace during their educational process or in their athletic training education program, which really leads to the increased understanding of what this setting is really about before they graduate. And then lastly, there were definite deficiencies in curriculum that really led to their current lack of preparedness for being an industrial athletic trainer or working in, the ISM or occupational health realm. So kind of just went over those 3 themes. Every single participant mentioned those 3 themes several times throughout the interview process. You can see there that the frequency of occurrence for each theme, 46 for theme 1, 34 for theme 2, and 104 times a deficiency in curriculum was mentioned. So I feel like that's pretty significant. It means that we've definitely got some things that we can add there. So we went over those research questions earlier. So let's go ahead and tie that to what these participants are telling me needs to change for their program, right? So quick review, that first question is, what skills did they have during their education? Well, two skills kind of came to mind to most of the participants, and they are evaluation and soft tissue techniques. So accurately obtaining evaluation and a history were identified as basic skills that they did learn within their athletic training education program. Participants agreed that this skill is definitely needed, allows for, improved patient care in the industrial sports medicine setting. And then the second skill that kind of came to the top was those soft tissue techniques. This was reiterated over and over with participants. For example, one participant stated, quote, "One thing I really translates well into the industrial setting is soft tissue techniques because OSHA allows for that type of treatment to be considered first aid," end quote. Second research question. So what are the actual realities they're experiencing on the job, right? Well, participants agreed that they knew very, very little regarding ISM during their education program. Of the 10 participants in the program, 9 out of the 10 stated they had very limited knowledge of ISM before graduation. So one participant stated, quote, "I had no education or guidance in the industrial setting at all in college," end quote. Another stated, quote, "It was just kind of like, here's the industrial setting. It's a thing. All right, we're going to move on. I remember talking about different settings in my courses. I don't think we really went in depth on anything," end quote. So most of the other participants spoke very briefly about their knowledge on IAT during their education, only using one sentence or two. And I truly feel like this could be due to just the lack of information that they were given, that they really couldn't even elaborate on their knowledge any further than just a sentence or two. And then participants noted that there were several deficits in the athletic training curriculum that included communication. Acknowledging the industrial setting and allowing students to understand the differences between this emerging setting and some of those other athletic training traditional settings will allow students to be a little bit more prepared to enter the industrial sports medicine realm. So participants agreed that because there's a lack of education, they didn't even consider this setting after graduation. Understanding those differences in IAT can allow students to make a better educated decision when choosing a practice that they want to, practice their athletic training profession in. So this communication really is important. And when I talk about communication, I'm talking about what industrial athletic training is, not necessarily communicating it back to like an employee, but the actual knowing and someone communicating what IAT is during your education. Overall, there was a common theme that information concerning this setting really was not communicated to those participants adequately during their education. So we want to add communication about how the industrial setting differs from other settings, because this really could allow students to make a better judgment on those interests that they have and help them apply for jobs that they feel like would be well suited for their profession and their career going forward. So I mentioned previously Dr. Nikki Harris's study post-COVID. So, perhaps maybe some of those ATs who are joining industrial athletic training post-pandemic really would have taken a more linear path to ISM if they had the knowledge of this setting prior to graduating. So this kind of leads to, having more confidence on the job and really sets us up for success in athletic training. And then moving on to that third question. So what skills do you feel like you could have used in your education that would have prepared you better for your work in industrial athletic training, right? So 3 common themes. And I think if you look at this slide, you will probably like, that makes sense, right? So the skills learned on the job really that proved to be vital were ergonomics, OSHA guidelines, and communication, and specifically communicating appropriately with the working athlete. So a lack of knowledge in ergonomics was mentioned 44 times. Overall, 28 of those 44 were directly tied to the need for more ergonomics education in the athletic training education program. So one participant stated, quote, "I wish I had more of my education based on ergonomics. I don't necessarily feel equipped to make a lot of ergonomic recommendations, and I wish I did. I had some basic ideas of office ergonomics, but I wasn't really trained in any of it. It was just kind of combining my common sense with my understanding of body mechanics and injuries," end quote. Another participant really noted that, ergonomics is really important in ISM. And if they were, educated on ergonomics at all, it really would have encouraged them to go into ISM post-graduation. So moving on to OSHA guidelines. So a lack of knowledge was mentioned 41 times. Overall, 24 of those 41 times were directly tied to the need for curriculum development to include OSHA guidelines. I'm going to paraphrase one participant here because they said a lot about this topic, but to paraphrase them, they said, "I think having a course in OSHA would be incredibly helpful because it's not really talked about within the KD program." Some of the participants of this study remembered talking about OSHA briefly during their education, but then went on to add that really more detailed information should have been given to them in order to take kind of paint that better picture of what our scope of practice is in this setting, and how OSHA really has that place that we need to kind of encourage to be stayed in as we work with OSHA, as we work with clients, and as we work with those working athletes in the workplace. So most people thought that they really weren't taught to understand how these guidelines affected their practice and what they couldn't do versus what they could do on the job to avoid causing reportables. And then lastly, what else was missing was really soft skills. So soft skills like communication was mentioned 14 times, and 13 of the 14 times that it was mentioned was directly tied to skills, communication skills learned on the job and not in the classroom. So participants agreed that, working athletes who work in shifts require different rapport building than just working with that traditional athlete, or and building that trust with working athletes is much different than building a trust with your traditional athlete. That soft skill of how to appropriately speak to an employee and gain their trust was discussed over and over and over again by all of the participants. Overall, there was a common consensus that when you're speaking to a working athlete, it is very different than speaking with a traditional athlete. And that really needs to be talked about during the education portion of your career. Now, these were the top 3 that kind of came out. There are other deficiencies that were mentioned, of course. Some of those included a lack of knowledge of workers' compensation and general medical issues. With an aging workforce that you're working with, it is a unique subsetting of work-related injuries. These 2 issues affect the working athlete unlike other athletes, right? So some athletes really know their body. They know to come to an athletic trainer. You're right there for them every day. But the working athlete may have not had anybody working with them before. They don't know their bodies. They don't know how to, they've never had anybody ask them about it before. So it is a very different skill to work with. Overall, studying OSHA guidelines, incorporating ergonomics education, and providing our students with those soft skills needed can really better prepare them to be a well-rounded athletic trainer ready to work in industrial sports medicine. All right, so how does the research questions and the themes and the results of this study kind of work back with our theoretical framework that I talked about earlier? So if we're reviewing research question 1, that evaluation, history taking, soft tissue skills, massage skills, really that helps to fulfill the athletic trainer's needs and allows them to feel more confident on the job. So, actually a prominent athletic training researcher in 2020 stated that esteem is manifested within healthcare providers as competent work, and it makes them feel like they have some recognition for a job well done. So being able to take those skills and provide them in this setting allows that athletic trainer to build esteem, feel confident, and really build those relationships with their working athlete. So for research question 2, what are the actual realities experienced on the workplace? Participants explained that their perceptions were of skills needed to be affected when working in the industrial setting. So those needs for belonging and comfort must be met in order to allow athletic trainers to become their best selves and give excellent care, right? So we want to acknowledge the lack of, fundamental knowledge, right? We want people to know that industrial sports medicine really relates with how fulfilled you feel on the job and how you can kind of move up that order and up that pyramid. And then lastly, those deficits in education. Building rapport with a working athlete really allows that industrial athletic trainer to feel that sense of belonging, right? Builds for better relationships. And, Maslow stated that fulfilling love and belonging in the workplace really can allow for a positive work culture and establish that rapport needed to assist an individual with their needs. So by building on athletic trainer skills in the industrial setting, it really does help athletic trainers continue to move up and reach their needs, and then, eventually reach self-actualization. Okay, so I know I mentioned before that there really isn't a lot of current literature or evidence on this, but really what is out there did not refute any of the current research on this either. So it's kind of right in line with that. The present study is one of the first in its kind to build on this important topic because there is that minimal research before on the perceptions of current athletic trainers practicing. There are no other research studies or recent studies that show the perceptions of industrial athletic trainers. And the findings of this study can really add value to the profession of athletic training by improving literature, not only regarding industrial athletic training and occupational health, but the barriers that we are facing as athletic trainers in the workplace. There are some shortcomings in literature prior to. However, there are no recent studies that refute that and show the perceptions of ATs. So, I think it's really important that we continue educating ourselves, continue passing on that education to other athletic trainers and really getting them involved. What we want to do is really implement some of this results of this study into the current curriculum and clinical practice so that athletic training education programs can cover these skills needed and better prepare athletic trainers to work in industrial sports medicine. By implementing this, you're really mitigating that gap in preparedness that we're seeing right now. So implications for practice. If we were to implement these changes into education, it would, as I've said, allow them to be prepared. So one example of an opportunity that emerged during this study included having a continued explanation of what an AT is responsible for in the industrial setting. This allows students to learn the similarities and differences of on the job compared to other athletic training settings, right? It can give them that greater understanding of how rewarding this profession can be. One participant actually stated during the interview process that they would have gone straight into industrial athletic training had they known how rewarding it is to work with the working athlete. One of the things that emerged really was that it's different than working with another traditional athlete, because they really, truly, I'm sure you guys experience this daily on the job, they're just so happy for, the attention and the care that we give to them on site. They don't have to go anywhere else to get that. We're right there helping them. And, that was really rewarding to them. And had they known that in their education, they probably would have went straight into IAT. Knowing the specific needs of of an employee also allows for competency in knowing what they really need in the long run. So there may be a benefit to other healthcare disciplines. So according to some of the participants, although ATs are not expected to be experts on general medicine, the ability to kind of show competence and knowledge on general medical issues and communicate regarding health and wellness initiatives will improve their ability to kind of refer that working athlete to the appropriate healthcare provider when needed. We know that we are the type of people who need to be well-rounded, right? We love to pivot here at being an athletic trainer. So typically, industrial athletic trainers are very well-versed in providing education on company and client benefits, right? So we really work with our employees to guide them and refer them to other benefits that they can take advantage of. Most employees don't know how many benefits their companies provide. So by being confident and having all of that knowledge, we can now pass that along to our working athletes or employees, and really just do everything we can to help them get better and assist them for staying on the job. So to be successful with this, engagement with the working athlete and building that social rapport can really build trust and allow that working athlete to open up regarding any of their health concerns. So allowing, clinical rotations in industrial sports medicine, or finding clients who are willing to take on an intern or some sort of clinical rotation really helps to build that athletic trainer into a better industrial athletic trainer. So newly certified ATs can build that confidence up. They will reduce their anxiety into coming into this particular profession, and it will assist them in learning those words that are needed to help assist that working athlete. And then lastly, this research allows for the change needed to educate students on this setting and really help them fall in love with it, much like I did, right? We want them to have a better understanding of it and how rewarding it can be. So, with that being said, what do we do with this? What can you guys do with this information? So number one, communication is key, right? We want to get the word out there. We want to talk to other newer athletic trainers. We want to spread the word. We want to tell others why this setting is so important. Most of you probably still communicate with your AT professors or program directors, clinical coordinators, preceptors. So, we can talk to them about the industrial setting. We can let them know how important it is. And then, it could potentially change some of their program, their education, the classes that they teach, and hopefully incorporate some more skills on industrial athletic training in there. Don't shy away from the conversation. Guide them to answers. So if people, in the profession or people that who don't know much about IAT have questions, guide them to those answers or kind of connect them with somebody who can. You're always welcome to reach out to me, but also just keep being you, right? Continue doing the great work that you're doing as an industrial athletic trainer. Continue being those, just like light that shines and lets people know, what we're about and how we can continue helping. I would love to see more research in the future on this, right? Maybe some in-depth research on what ergonomic topics would be most suited for education on, so that IATs can be more prepared. Maybe a larger quantitative study, maybe a study including other emerging settings, military, performing arts, etc. It would be great to have a study with just the master's programs out there, as opposed to, my study who kind of incorporated everybody, or even other populations, or other people who transition into industrial athletic training. And then I really do feel like it would be great to get the perceptions of program directors, clinical coordinators, and educators as well, to see, what their perception is and how their perception correlates with what is really the realities of us here in industrial athletic training. So I don't want to, I know we're close to time, so let me go ahead and give you, if you stayed this long, you deserve the code word, right? So the code word for this is oblivion. So make sure you write that down if you're, collecting those code words. And, I'd love if any of you guys have any questions, I'd love to take those right now. Thank you so much for listening to this and helping us grow the industrial athletic training setting.
Hi, Janelle. We did have a question earlier in the chat. Carl's question was, why do you think there's been such a large shift of ATs going into the industrial setting?
Yeah, I think that COVID had a lot to do with it, because you had to practice in a different way during COVID. But also, we all know that work-life balance is something that people strive for right now. It is a different era that we work in comparatively than before. So I know a lot of people who I work with, or new athletic trainers that are employed, by my particular company, they're looking for that work-life balance. They're looking for that, fulfillment, but also being able to be home with their families, being able to use their skills, critically think a little bit differently, which you do in this setting a lot of times as well. So I think there's a big shift for that. And then, of course, the opportunity to move up the pay scale. We all know that, collegiate is a little bit different for that than we are here, in the industrial setting. So I think that's a big driver as well.
Yeah, great answer. Anybody else have any questions? You can raise your hand, put it in the chat, or just unmute yourself and speak up. All right. Well, thank you, Tanil. We all enjoyed the presentation. And thanks to everybody for attending. I know we have a couple of little things coming up towards the end of the day, the AT chat. But thanks for sticking with us, and be sure and check out the job fair in the Discord.
Awesome. Thanks, everyone.
This concludes the IETS On Demand Continuing Education Program video. To claim your CU, you must be a member of the Industrial Athletic Trainers Society and complete the form Claim Your CU found in the YouTube description. If you have any interest in learning more about what the Education Committee has to offer, reach out to the email address on your screen. If you would like to volunteer your time to speak on a topic that interests you, please reach out. Thank you, and stay safe.